providing safe and affirming homes for unhoused LGBTQ health youth, particularly Black trans children. Dr. Lulu's advocacy is rooted in her mission to promote mental health, gender and sexual affirmation, and health equality for marginalized communities. A 3-time TED Talk speaker and internationally renowned speaker, she aspires to change through powerful storytelling and practical solutions. A published author and adjunct professor, Dr. Lulu also leads workshops in LGBTQ advocacy and community allies. Her recent focus is on empowering healthcare professionals to become allies and advocates for their LGBTQ patients through the Affirmed Health Professionals Prescription Program, also known as TAP, fostering a world where LGBTQ patients can begin to build their trust in the healthcare system again. Her much anticipated book about your Black transgender child is out on Amazon. Please join us in welcoming Dr. Lulu to the Cleveland area, and a huge thank you for being here today.
Thank you. Thank you. So I usually speak from the floor. And I was told I need to stand here. I have ADD, ADHD, and other things in between. That's gonna be hard, but we'll try. Thank you, thank you, thank you. So, the pronouns that affirm me are she, her, and mama, beast. I came up with mama beast with my ex-wife and ChatGPT. We were trying to figure out which one was going to work better, because you know they're mama bears. And I asked ChatGPT, I said, what's the difference between mama bears and me? ChatGPT said, you're black. So mama beasts are black. And so I went ahead and I called my attorney. I said, can I trademark that pronoun? And he said, yes. So I own the pronoun mama beast. Thank you all so much for having me. This is going to be a fun conversation. I'll do my best to stand here as much as I can. I don't have to. Okay, super. You're in for a treat. And I asked them to keep me after lunch because I usually keep people awake, but I have to catch a flight soon after this talk. So you get me before lunch, which is still okay. Still okay. Boom. So this is the official title of my talk that Dr. Mia said I should talk about intersectionality of identity and disparities in care. I said, okay, I'm going to do what I was told to do. But because I can, I have a new title. What you don't see is hurting your patients. We're going to talk about invisibility today. Is that can y'all still hear me? Yes. Yeah. One of my favorite things to talk about is hiding in plain sight. Who's ever experienced that before? Oh, okay. Either y'all like me or you like me. So, that picture was designed and crafted by ChatGPT. I said, I want you to give me a picture that shows someone hiding in plain sight. Do you think ChatGPT did a good job? Yeah, I think so too. And maybe that's my kid. Who knows? We'll never know. But one thing that I know for sure is LGBT plus patients are usually hiding in plain sight. Children hiding in plain sight. Adults hiding in plain sight. We're all hiding. We all have closets. Everyone's closet has something in it, people. How do I know? Because I have a few closets. So, how do we go from hiding in the closet to being fully seen and fully affirmed by the one person who took an oath to first do no harm? And what I did was flip it because I can. So I used first do no further harm. The only time you're allowed to make an assumption in medicine is that the patient in front of you, who happens to be blessed to be LGBTQIAPPOI2S, comes pre-traumatized by you. I need you to remember that. The patient in front of you is already pre-traumatized, meaning do no further harm Because a mama beast might come for you if it's my child, right? And so the official objectives that Dr. Nia gave me were define intersectionality of identity, connect identity with healthcare disparities, identify patients most at risk for poor outcomes, and I added commit to at least one change that will make your care more affirming. Should we really say today? Is that thing shaking or is it me? Okay, I just want to see. I didn't drink coffee, but you know. Okay. So commit to at least one change. That to me is the main objective today. So it's highlighted. And because Dr. Nia said you have to give these, you have to write these official objectives for CME. Or because I can flip it, which is what I do. We're going to look at a journey. We're going to take a journey today. Okay? And so the first stop is at the intersection of the human hook. I love ChatGPT. The human hook. We're going to look at the faces that are hiding in plain sight. Who are these people? Because of that quote. You want to read the quote for me, my friend?
Intersectionality is invisible until it harms you.
Thank you for adding the you. Because all of us are in there. So intersectionality is invisible until it harms. And as physicians, healthcare providers, caregivers, social workers, all the things, the one person we don't ever want to see in our office is who? An attorney. You don't ever want to see an attorney. I don't care if he comes as a patient. Don't believe him. All right? So you meet my daughter. You hear my story. I'm talking about what gets missed when we don't see who? The whole person. I was talking to someone about this recently. They were like, oh, you know, I treat all my patients equally. I said, you can't. He said, yes, I do. I said, let me tell you something. I am, for all intents and purposes, a black woman, right? So is Dr. Nia. So let's just say Dr. Nia and I walk into your clinic. 2 black women. Can you honestly treat us equally? It's a trick question, isn't it? I'm 56. She's not. I don't know how old she is officially. Wink, wink. But I'm 56. I have short hair. Sometimes it's blonde, sometimes it isn't. She doesn't. Okay, we both wear glasses. Mine are blue. I've got 3 babies. My oldest actually turned 27 yesterday. She has none. You know what I mean? You cannot treat any 2 patients equally, my people. So don't say that again. Sir, I told him as I walked out of his office. So, today's journey, second stop at the intersection of the harm, the actual harm. We'll look at some numbers again. No, not really. I don't like numbers, except if it's in my bank. The zeros. Disparities, disconnection. If the lawyer comes to your office, there's been a disconnection, my people. You took an oath to first do no harm. The lawyer is there because someone got harmed. Because you're about to get harmed. Big time. What happens when race and gender and immigration and all the things, what happens when they come together and there is bias, this guy right here. And what does it look like in your patient's eyes? Through your patient's eyes, what does it look like? What do you look like to my kid? That's the question. How does the patient feel when they leave your office? Are they going to take a bus, a one-way bus to the Golden Gate Bridge? Or are they going to tell their friends, oh my God, y'all, my doctor is dope. I felt seen. My doctor is woke. I felt heard. Y'all need to go to my doctor. She's the bomb. What's going to happen? The third place we're going to go to today is at the highway to healing. Because what's the use of rounding you guys up, telling you a lot of things, and then I don't tell you what to do? We're going to look at language, and of course my favorite word now is unlearning. Because if you can learn bias, my people, you can unlearn. Oh, can I use that word here? You can unlearn it. My bad. I said chicken, that's what I said. So, what can we do right now to affirm your patience? What can we do right now to affirm? What does affirm even mean? People use that a lot. I'm going to pick on someone. What does affirm mean, my friend? What does it mean to affirm someone? Take a chance.
Meet them where they are and see them for them.
That's a start.
Yeah.
Say it with your full chest, like we say in Nigeria. Own it. What does affirm mean?
I would say just seeing them for them and I guess start with that, of course.
How are you going to affirm my baby if you don't know what affirm means? You see what I'm dealing with you? I want to take a chance and tell them what affirm means. Tell the people. Affirm, this word that we use all the time. What does it mean? If you don't know what the word is, how are you going to practice it? We're going to learn today. Boom! What's a talk without an icebreaker? I want to know you guys. I want to get to know all of y'all. So my friend over there is going to present an icebreaker for y'all. Because we can. Think about your last patient that never returned. Why do you think they didn't? Go. Do your thing. You should be able to respond. I don't know how it's working, but yeah.
Let's go.
Yeah. So, do y'all know how to do it? Because I don't. Supposed to give us a word cloud if you do it correctly. So join by text send CCME 987, is that it? And your message to 22333. Disappointment, that's one. Somebody got it? Somebody's woken, somebody's awake and woke. Yes, word clouds. Oh my God. This is my first time doing this. I'm so excited. Oh, it's the little things, son las cosas pequeñas. Insurance, disconnection, because miscommunication, unheard, fear, misunderstood, disappointment, felt, unheard, safe, scared, unsafe, unheard, something needed, something, disconnected, listened, I don't know, all the things. Yeah, but so didn't all of those things, is that what it is? But isn't that cool? So that means we all have had a patient that didn't return. And they did not return because you were the bomb. Right? Unsafe. Scared. Oh, did I do something?
It's there.
Okay. So, unsafe. Disappointed. Disconnected. I don't know what partner listened, not sure. Unheard. Something. Fear. Misunderstood. Now, can you imagine traffic? That's interesting. Can you imagine your patient leaving your office, feeling this way? Or maybe you all were the patients that felt that way. Can you imagine going to the doctor and leaving feeling that way? But it happens every day to all of us. And so, thank you so much for playing ball with me. Can we go back now? Okay, so, Mom, I'm done. And let me tell you, my daughter is 5'9". She's trans. And she's a princess, self-proclaimed. I guess I believe her. She was like, slam the door. Mom, I'm done. I'm like, done with what? I'm just done teaching my doctors how to treat me. She's like, I'm done. And while I thought it was dramatic, because it was, I was pained those words. And by the way, she turned 27 yesterday. So y'all, please just say happy birthday, Peach, if you don't mind. Everybody just say happy birthday, Peach.
Happy birthday, Peach.
Thank you, she was here. So that was only one, I think it was 6 months old, I'm not sure. See, I used to be so pretty, look at me with long hair. I can't keep teaching my doctors how to treat me. That's a powerful sentence that summarizes what you all just gave me in the other slide, right? She goes in for a headache and sore throat, and the doctor is asking her about her genitalia and her gender identity. Would you like that? If you're not going to ask me about my genitalia or a headache and a sore throat, why are you asking my kid? Objection, Your Honor, relevance. Right? For the lawyers in the space. Now you would think me, with all my wokeness and cuteness, you would think that as a doctor, and as a queer woman, and as an immigrant, and as a speaker, and all the things, you would think I would have picked on my child. I would have picked on the fact that she's trans. You'd think I would have noticed and started affirming her sooner. You would think that. I still miss the signs. I kind of suspected we were gay, but I wasn't sure. And I did the unthinkable. I said, so, is you gay or is you not gay? You don't want to do that. You don't want to put a 12-year-old in the spot. Because what's the kid going to say? I don't know. And then what I heard was, no. Because parents would want to hear what we want to hear. Unfortunately for her, though, even as a physician, she said, Mom, I would have never, ever told you. I said, why? She said, because you were my pediatrician. Because she came to my practice. I had other doctors, but she came to my practice. She said, because you were my doctor. You didn't listen to me at home. You're not going to listen to me at work. My own kid said this to me. I made all the mistakes, people. So you don't have to. But the most important thing that I missed, the reason I say why I missed the signs, the most important thing that I missed is intersectionality is invisible until it harms. When I walk into the room, a lot of times people see a black woman, and they're right. I don't know where the word black came, I just work with media. You don't see a 100% disabled US Air Force veteran, do you? It's invisible. You don't see a queer woman, do you? Do you see a mom of 3? It's invisible, right? Do you see someone who has fibromyalgia? It's invisible. Do you see someone who was sexually assaulted 3 times before the age of 17? It's invisible. See what I mean? Intersectionality is invisible. But here's the thing though, most people when they hear about intersectionality, with all due respect, they think about Queen Kimberly Crenshaw, right? And I'm going to talk about that in a minute. She talked about systems, and that is true. But I want to flip that a little bit and talk about emotional intersectionality. The pain that we miss. The pain that I missed in my kid. The pain of misrecognition. We see them as difficult patients. Oh, Miss Susie's here again. Oh, she's back again. Oh, the dramatic mom or the dramatic child. We see them as non-compliant, but we don't see them as disempowered, do we? You don't see a black trans woman as unheard, do we? When somebody talks louder, do you think that they feel heard to talk louder? Think about it. The woman who's complaining in the waiting room, somebody's going to see me today. Is it because she feels seen? Think about it. Do we see our patients as unheard and disempowered by a system that was not built to see me with all my intersectional identities that are invisible? Right? Okay. The pain of emotional labor. The kid came to see the doctor. The doctor wants to talk about gender identity. She's done, tired of being the one teaching her doctor how to see a trans patient. And yesterday, Dr. Nia was sharing a story about how some other people in the area, every time they see an LGBT patient who talks about PrEP, they say, oh, send them to the center. Oh, send them to the center. That's a lot. Everybody needs to learn about how to take care of this. Because the situations are here. They're not going anywhere. Plus, you took an oath. The oath is not just for the money and the status. You gotta do the work. Learn about my kid. So I don't have to take off my earrings, right? Good. Emotional pain of mistrust. The patient is quiet in the room, and you're thinking, oh, what a good patient. They're done. They're not speaking to you anymore. They're disconnected. They've removed themselves, like, you know what, whatever. Yeah, sure. Thank you. And they leave. And you're thinking, oh, okay, and another one. Didn't say anything, she didn't complain. Or they completely avoid you, they don't come back, like we talked about, right? Do you know that visibility is not the same thing as vulnerability? Like, just because you see me, doesn't mean I'm going to be vulnerable with you, baby, right? Okay, I learned that one from ChatGPT, I thought that was cool. And look at that pain of isolation in care. This happens a lot in the military. I'm a former commander in the US Air Force, and one of the things that they did in 2016, there was a study that came up about suicide. Trigger warning, please, okay? In the military. A lot of the people who wrote suicide notes, you know the one word that was recurrent in almost every single suicide note? For a copy of my book, who can tell me the word? Who said what? Say it with your full chest, well, we're Nigerians here. Lonely. Who said it first? Who said it first? Now nobody wants. Okay. So I was gonna give a copy of my book to the person who said it first, but none of y'all. So I keep my book. Loneliness was the word. In a freaking barracks, in an army barracks where there are thousands of people. That's how my patient feels in the waiting room. They're surrounded by all these care providers, yet they're completely alone. So what is intersectionality? What is it? I'm going to come to the back. Those at the back. Yeah, your turn. What's intersectionality? Table 9 for the win. Anyone? Not you. Anyone else? Chest, baby. Chest talking. We need to talk about full chest.
It's all the different parts of your identity that meet in the middle of that.
So she said something about, they said something about all the different what?
Parts of self, like parts of your identity.
Okay, all the different parts of your identity. That's 1 out of 3. What's the second one? What's the most important part of intersectionality? Anyone? Table 10 for the win. For a free banana. Not my fan.
Coming together.
Anyone in the room?
The overlap, how they affect individuals who experience them all.
The overlap is a good word. What are they missing? You know, when the teacher keeps asking the question, the answer hasn't been given. What are y'all all missing? Discrimination, of course. Oppression, how they interact with the systems of oppression. That's what's missing. There has to be systems of oppression. That's intersectionality, my friends. Not just having not just having all the identities. True, multiple identities, true. Interaction, true. The third part is the systems of oppression. That's intersectionality. Don't y'all ever forget it, because Dr. Lulu taught you today that what's the piece that makes the difference is the fact that there are systems in place. And I want to talk about that because I don't want you to leave here feeling down, feeling bad, that, oh my God, I don't see my patients as verdad. You don't, because we're not taught to. I wasn't taught to see myself. I went to med school in the 80s in Nigeria. I was deep in the closet. Oh my God. They were mentally ill when I was in medical school. Who went to med school in the 80s here? Anyone? Am I the only one? Dr. Ing, yes, no, maybe so. No? Nobody went to medical school in the 80s. Oh, I love it. Love it. So, you like my shoe? All right, so the intersectionality part is how systems are created to hold them back. And I want to show you something that I think, so it's not just identity, it's systemic compounding. Does that make sense? There was a pharmacy here, the pharmacy is a system about compounding, systemic compounding. That's like keep. Even when you try to cut, no, stay down. That's intersectionality, not just the identities. Does that make sense? Yes. Okay, so I want to show you this. That's me in the middle. Brown girl in the rain. So, when I walk into the room, you only see a black woman. You don't see all the others. When I start talking, you say, yeah, she's probably African, but I'm Nigerian, only Igbo. I'm Igbo. You don't see some of all those other things there. They're not visible to you. Intersectionality is invisible until it causes harm. Remember that, okay? So I want y'all to do me a favor, if you will. Everybody, think back to your all right. Write 5 of your intersectional identities that are usually invisible. Go. 5. Dr. You. Hi. You don't want to write? You can just tell me. Yeah. 5 of your intersectional identities that often go unseen. What happened there? Okay. I think I pressed it. Hey, you told me not to press it. Sorry. So what are some of your identities that are often invisible? For me, the only thing you see, truly, is black. And do you know why you can't see woman? Who wants to tell me why, when I walk in the room, you see black but you don't see woman? I like your smile. Because I have clothes on. See. Oh my God. No, it's not that. No. Who can tell me why, when I walk in the room, you see black but you don't necessarily see woman? For a copy of my book, okay, let me up the...
Self-identification.
Yes! Who said that? Because gender identity is a deep, personal, internal sense of self. Yes! You get a free book, so please, yes, you get a free autograph book. Because when I walk in the room, you do not know my gender identity, people. Do not be fooled by my clothes. Get it? Yes. What I want y'all to hear me today is how your patients are hiding in plain sight. You can't just assume. That's why I corrected myself when I said she or I said they. Because I don't know. They are affirming pronouns until they tell me. So you don't know. So you don't see woman. You see a black person. Maybe you see a black female, actually. Because woman is a gender construct, whether you like it or not. Okay, gender identity is a deep, personal, internal sense of self. Only the person knows their gender identity. That's not the talk, but thank you. All right, so who wants to share 5 identities that are often unseen? Come on, friend. Got 3. I'll take 3, yes? Heterosexual, okay, I'll take that. See, I just love it when the heteros just want to come through. Love it. Hey, you know what? Yes, you must have been the one that asked that question about what the homophobic people feel. I'm like, they need to feel. But, thank you. Who else wants to share? You don't want to share, so we call on you. 5 of your identities that are often overlooked, unseen, invisible. Tell me. How about the daughter part? You have to be born out of a kid. But I like that. I like the dancer part. That's definitely invisible, right? Definitely, but thank you for trying. But I want you all to remember the identities that are usually invisible, even for you as the caregivers. Want to tell me some of you?
Sure. I'm a mother and grandmother. I'm a big parent and mother of a queer child. I'm an army veteran. I'm a Muslim.
Thank you for your service. all the moms. So yeah, so anyway, hopefully I've made some points about intersectional identities that are often unseen, which is why I can't treat you like anybody else, even though you all walk in here looking like, I can't make that assumption. I have to ask you. Okay? So remember to ask your patients. So when intersectionality is invisible, we have invisible harm. Emotional labor, isolation, medical mistrust, misrecognition is invisible harm. We're going to be trauma-informed caregivers is what we're looking for here today, right? Knowing that the patient is coming in pre-traumatized. Y'all just give me a list of 5 things that people don't see. When I walk into the room, you don't see that I'm a physician. People usually ask me, man, where's the restroom? Or they ask me, they think I'm the cleaner. It's like, it weighs fine. Until it's not. Right? Then I said, no, I'm actually the speaker. Oh, you're the speaker? Yes. Oh, okay. Oh, it has empty right there. It's like, are you a doctor? It says empty right there, but are you a doctor? Like they ask, not here. I mean, just generally speaking, just assuming. So I assume that most of us are walking around with a story and we're walking around pre-traumatized, okay? But today we want to center the lives of the queer folks, so it's not about any of y'all today. So how does intersectionality show up in medicine? We're almost done. How does it show up? How does it show up? How does it show up? Okay. Read that first, my friend.
Queer youth mental health/suicide cover project.
Trigger warning, 39% of all LGBTQ youth, according to the Trevor Project, 39% of all queer youth have experienced mental health and suicidality in the last 12 months. That's almost 40%. 46% of gender queer or non-binary and gender non-conforming youth, 46% of them in the last 12 months, considered seriously suicide. 50%, though, of those who needed mental health care had no access. Why do you think that is, Matthew Paget? Why do you think?
Probably a lot of barriers.
Give me one.
Insurance.
Okay, I'll take that. Okay. Give me another one.
Transportation.
Transportation. We just had that whole talk about, was it like 26% of the BIPOC? 1 in 4? That's me, right? What else, my friend? Not feeling safe. Yeah. You don't get a book because the book is already given, but good try. Oh my God. Trans patients mistreatment, negative experience. 48% of those who were asked said they feel traumatized. They've had a negative experience at their doctors, which includes pharmacists. Don't be thinking that there. Then when they say I went to the doctor, to them, right? Now, what do you think is my thought about 48%? What do you think is my thought? Now, I know that's kind of crazy, like what's such a Lulu thinking? What do you think I'm thinking about that number, 48%? Yes! And I was asking you, Dr. Lipo. It's an underestimate. There's no way it's only 48%. I don't believe it. My kid is not in there. Most black kids are not in there, right? Because the numbers, because the systems don't consider black experiences when they ask these questions. Could I be lying? No, I don't think so. This is herein lies invisibility. But 48% is a lot. That's 1 out of 2 trans people who leaves the doctor's office feels that they've had a negative experience. A negative experience begins from when they're at home, when they call your office, and the person at the front desk is like, "Sir, did you say your name is Mariam?" "Yours, my name is Mariam." Like, it's like, okay, like, no, you don't get to judge, right? It starts from when they look at your website. Do you have any kind of signs that you are affirming? Like, it's not when they come into your door. That's later. They might never make the appointment because of how the front desk, right? So all of us in the practice are responsible for making journey is affirmed. Each time. That's a lot. Is it a lot, you think? No, it's not a lot. That was a trick question. It's not a lot, because you took an oath to do no harm. To everybody, not just some. I had a friend who told me, she said, well, what if it's against my morals? I said, your morals, for real. You're in the wrong job. I'm just saying. Please, you guys, invite me back. Don't look at my fingers. Yeah, just. But you see what I mean? Like, truly. I wanted to talk about this one and then we'll go on because we're almost done. Heterosexual black women and HIV risk due to MSM and DL. And I know we already kind of talked about it in the other talk, but 60% of new cases, right? And yet in this room there's a paucity of black women. Dr. Mia, what you have to say about that? If I wasn't here, you'd be the Lone Ranger. Yeah, I know. 60%, and yet black women make up 13% of the population. That's what the 13th is. So where are the black patients? Donde están las gentes? Where are they? You have to get them in the room. They have to be here to learn. Or, how else would they learn? Somebody's listening. We tell them, we say to every last one of them, we test everyone. Stop being shy or feel weird about saying something that's going to make your patient say, thank you, doctor. It's about the difficult conversations. It's about feeling uncomfortable. That's how you grow. It's called growing pains, not growing joys. They have the whole joys over here. It's like pains, right? But I want to tell you a story. Over the weekend, I was at BC Black Pride. And I was in a room filled with about 600 to 500 black gay men. For all intents and purposes, I'm lumping the non-binary folks together, okay? I did that on purpose. They had visibility for one weekend. But for the rest of the year, they're hiding in the shadows. African ancestry, my people, my siblings and nibblings. Many of them are men having sex with men for that weekend, and then when they go back home, they become what? Invisible is good. I already told you that, Mama. Don't do me like that. What else do they become? Who said that? Who said that? You don't get a book, but you know what? I'm gonna give you a book at this point because you're doing well. Mia, remind me about Amy. Thank you. They become heterosexual, in quotes. Here's the problem, not the men. HIV doesn't ask for your orientation. It's like equal opportunity. You there? Come fly with me. Fly away, right? What's that? Say that for me. Have you heard that before? Who has not heard HIV possible? Yeah. Well, all HIV possible. HIV doesn't play. Now, I'm only picking one of the STIs. It could be anyone. Well, all HIV possible. And here's my problem. Boom! Do you want to read that last line for me? You, my friend. The last one.
And we don't ask them.
They're invisible in the clinic. I just told you I was in a room with about 600 black African men, immigrant men, okay, African American, whatever, right? All of them for that one weekend were out. And then for the rest of the year, they're not. And they come to your clinic. Will you remember this talk and ask them? What will you ask them? You've been in this talk all day today, what would you ask them? What do you think I'm going for here? What's the name of the speaker? Jen. What was Jen talking about? When Jen gave the talk, what Jen was talking about? I want to make sure that we're all listening, right? I want to make sure, so I'm an includer by nature, my top 5 includer. Like literally, I go back and say, well, how about so and so? I want to make sure that you're following. I know I'm dramatic, I know. But you need to be following. So what am I worried about? What am I asking you if you're going to ask them? What?
Well, what I can do to help them is to see everything along you've got to find out.
It's a very long sentence. It's incorrect, but good try. What do you think I want you to ask them, my friend? Where am I going with this? This is an entire community that is hiding in plain sight. In the clinic, they don't trust us, so they don't tell us, and then we don't ask them what? Who they are, in what aspect?
Sex life.
Oh, thank you. Who said that back there? The back row for the win. When they say talk about it for those at the back, that's what you guys just did. I love it. Thank you all so much. I know I come all up in your face, I really do. But I need you to get that these people are hiding in plain sight. They're not going to tell us because last weekend they came out of the closet, they had a good time. For the rest of the year, they are hiding in the closet. Do you think they're going to tell you when they're hiding in the closet? Why don't they want to tell you? They don't trust you. Why? You specifically, Danielle.
They don't know you.
One, but that's your patient. They're supposed to know you. Give me something else.
Shame.
Who said shame? Thank you. Why shame? Thank you. Why shame?
Because we're not taught that what they're doing is okay.
Right?
Socialized that this is bad.
This is bad because of IATs. Oh my God, I love you. We're talking about IATs. Tall guy. Yeah, we talked about IATs yesterday. Yes. Implicit association test, right? Where they found out that even amongst the healthcare providers, over 200,000 of them were sampled in 2015. And even amongst the healthcare providers, there was an 80% statistically significant test that came out and said, when we hear the word gay, we associate with bad. Literally. Like this is something that happened at the Harvard. Amongst doctors and nurses who are heterosexual and non-heterosexual, together, didn't matter. When you hear the word gay, you say, oh, bad. Why? Because society has told us that I am bad, for instance. I don't think I'm bad. You think I'm bad? Oh, right? But society is telling us. So they're not going to come and tell you. And that's why what Jan said about anyone who asks for doxy prep, give them, right? He said that. I mean, I'm paraphrasing. Like, don't ask how, why, whatever, because they might not want to tell you what she said. Even if they trust you. Even if they trust you. Who else is hiding in plain sight? So please, I want you all to make me proud about this. Okay? This should not happen. Shame should not happen. Our patients should not be walking around feeling shame. They can't talk to their doctor. They don't have access. They don't have a card. They don't have all the things. And then when they finally get to you, you also don't see them. That's an étude brute moment, right? Who knows what étude brute is? I want to make sure I'm taking you. Y'all know étude brute? Yeah? Okay, cool. Just want to make sure. So who else is hiding in plain sight? I was going to ask y'all to just shout it out. Who else is hiding in plain sight? Just shout it out. Bisexual. Ooh, let me tell you, I got stories on me. The first time I went on a date with this cute lesbian, she was like, so, are you going to make up your mind? I said, about what? She said, why are you dipping in both sides? I said, dipping in both sides of what? You know what she was calling? She said, I need to make up. I said, I didn't make myself bisexual. I don't know anything about that. Biphobia is real. Bi plus erasure is real. And then last year I found that I'm actually not bisexual. I'm pansexual. Yay! Like let me tell you, honey, it was something. Like, okay now, so what's she gonna say about that, right? I'm assuming y'all know what intersectional means. So black, queer, disabled, hiding in plain sight, that's me actually, right? Elderly, undocumented people, or elderly people, like the slash means or, right? Trans people, immigrants, uninsured. Raise hands, who else is hiding in plain sight? This is an easy slide.
Victims of violence.
Yes, we talked about that in the other study that I was talking about. Yeah, who else is hiding in plain sight? Yes, this table is doing well. Yes, yes.
Neurodiversity.
Yes, neurospicy folks like me. Yes. And we get judged, and if you judge me once, I'm not coming back. I don't care if you give me the best medicine. I'm not coming back. And that's where the harm happens, right? Give me one more. This table, save yourself. This table. Alcohol, they don't take it. Substance. So actually, I heard that somebody said drug abuse is a choice, but substance use disorder is a disease, something like that. And I was like, oh wow, I never thought about it that way. Something profound like that. I'm paraphrasing, I'm not sure, but yes, thank you. Because I can be walking around and this is like my one sober day in the year, right? Because I'm really good at acting, you'll never know. And I'll be hiding in plain sight. So I want y'all to remember about hiding in plain sight today, tomorrow, and always. But I want to save you. I want to save you from feeling that Dr. Lulu came and was talking junk to us, made me feel so bad, because they're systems. They're systems. And medicine, for real, is colonized. Right? When I was in medical school, it was about the 70 kg man. Is it still in the textbook? Is that still the person that they refer to? The 70 kg man? In the adult textbooks? No, not anymore? Well, I guess I went to med school in the dark ages. It's still in there. It's still in there? Thank you. Okay, all right. I read the book. It was 70 kg man. Now, let me ask you a question, because I'm just assuming that you're 70 kg. Who do you think the 70 kg man is talking about? Hint, hint. Caucasian males.
In the army.
You know, that part too, right? Caucasian males. So 70 kg man is not talking about most trans masks. Think about it. Most black men are not in the studies. So that 70 kg man is not representative of my family. So there's systemic violence. Here's the problem with systems. Who makes up the systems?
Old white men.
You said it, right? The point is we make up the systems. We humans. Okay, so there's language disparities, there's provider implicit and explicit bias. When you tell me it's against my religion, that's explicit bias, my friend. Hi. Amen. Thank you for picking me up yesterday. When you tell me that it's against my morals, that's explicit. You're in the wrong profession. Don't touch my kid. You can't tell me this particular patient is okay, I can see this one and then I can't see that one. You don't get to choose. You're in the wrong profession. Right? Creating affirming spaces, colonize medical language, and really quickly, I just thought this was very interesting. I want someone to read this. Will you read that for me, please?
Colonized language shows up in the body, language, tone, documentation, and even clinical algorithms.
Even the algorithms. Even the algorithms. I had to train my ChatGPT. ChatGPT, I'm Igbo. Who is an Igbo woman? Oh, Igbo woman is Igbo people are in West Africa. So that's me. Stop thinking I'm a white female. I'm not. I'm telling my ChatGPT this, right? Algorithms. We have race. Y'all were here during the 2020 lockdown. We had that whole thing about Paul socks, right? Dr. Nia? About the Paul socks and the black skin. Amen. How will race, why should race, how? When I cut my skin is the exact same epidermis and dermis as yours, right? What's the race? All right? And then this one, decolonizing care, starts with decolonizing our language, because if our words harm, you want to finish that sentence?
Our care never had a chance.
Never had a chance, people. oh girl, Miss Subtle. What do inclusion, affirmation, affirming care mean to you and your patients? What does it mean? Should I ask you again? I don't want you to feel like she kept asking me and asking me and asking me and asking me. She didn't ask me yet. She didn't ask me yet. So what does it mean to you and your patients? What does it really mean to you and your patients?
Provide the care
I'll take that. That's a start. Yeah, that's a start. What about you?
To treat people the way you want to be treated,
I like that. I like that. What does that mean to you, Dr. Nia? Oh my God, you're going to kick me out. Oh my goodness. What does that mean to you?
For me, it means for me to be aware of their intersectionality identities and for me to be able to reflect on those things so that I can give inclusive, unbiased care.
All right. Quote that. Tweet that. Truly, awareness is the best medicine. Being aware is the best medicine. Okay, all right. So what it really looks like is, don't assume, ask the patient. So who do we have in the room here today with us, right? Don't just assume it's my sister. It might be my wife, y'all. Right? Who do we have in the room today? Mirror the language. If I call this boobs, call it boobs. If I call it chest, call it chest. If I call it vajayjay, call it vajayjay. Use my own language. Thank you very much. Audit your forms, audit your office space, train your staff, because your staff can make you lose the patient. While you thought you did a good job, how come the patient didn't come back? Well, because the front desk thought it was funny to quote some Bible verse as I was leaving, right? Explicit bias. Cultural humility, trauma-informed care. I think you guys have had enough of that. IATs, for me, it's all about bias on learning. True. We can just realize that bias is learned. Like a newborn baby does not come with bias. They learn it, and therefore it can be unlearned. My work here is done. All right, I'm gonna send you all to lunch. Boom. So, please give me an assessment, an evaluation. So my youngest child, who's 21, is going to say, Mom, so you went to Ohio, what happened there? Show me evidence, social proof. Please take a moment. And when you do that, you will get my free downloadable PDF of a bias assessment, quick bias assessment, quick language evaluation thing, and an affirmation kit, something we put together for y'all. Please and thank you. I really, truly appreciate it. When you're done, let me know, because this is like the last slide, and then I'll take questions. And then y'all can eat, and thank you so much for listening to me. Hopefully I was truly all up in your face. That was the plan. If I wasn't, please let me know so I can be in your face more. Just kidding. But yeah, truly, this is what I came to tell y'all. I delivered my message. Thank you so much, Dr. Ng. Oh my God. Thank you. Thank you for letting me do this. Mia, thank you for letting me do this. Thank you for the red carpet. I didn't even realize I was getting a limo to pick me up. I didn't even know that. Oh my God. I didn't take a picture. Are y'all done with that? About 2 minutes of the thing? Huh?